Welcome back. My name is Dr. Carl Baird, and today I'll be showing you 5 exercises you can use to increase knee range of motion after a knee replacement surgery. So this is one of the common concerns some people have when they come to my clinic after a knee replacement surgery, is they're really having a hard time getting that range of motion back, which makes it hard to do a lot of activities, even simple things like putting on your sock, putting on your shoes. So these are 5 exercises you can do to work on improving your knee range of motion. Before we get started, I did want to mention that these exercises are meant to be done after your healing has taken place. So right after the surgery, you should be going to physical therapy or a physiotherapist to work on this range of motion while the body's healing. These exercises are meant for the kind of 6 months or 12 months later on, once the healing has taken place. If that range of motion is not back, this is going to be the best time to do these exercises. So with that being said, let's go ahead and get started. The first exercise we'll cover is called the Quadruped rock back. So to perform this exercise, you're going to be on your hands and knees. I do recommend that you find some sort of foam pad or a pillow getting started, just to make it more comfortable when you're on your knees. But to perform, it's going to be relatively easy. You're going to start on your hands and knees, and then you're just going to bring your hips back to your knees, and you want to go as far as you can. And again, it just depends on how much range of motion you have at your knee. But once you get to the place where you feel stuck, it's okay to push it a little bit. We really want to get into that end range to start increasing that range of motion. So you kind of push into it, hold it for 2 or 3 seconds, come back out, and then you just repeat that, trying to sink further and further each time. It's okay if it's a little bit uncomfortable. Sometimes you have to push into that discomfort to really get that extra range of motion. So that's exercise number 1, the quadruped rock back. The next exercise is going to be called the hero squat. It's similar to the quadruped rock back, but instead of being on our hands and knees, we're just going to be on our knees. From there, we turn our feet down, and again, we just want to send those hips back towards our heel. So this is a little bit more active because we don't have our hands assisting, but it's going to be the same thing. You want to sink those hips back down. When you get to that point where you can't go any further, try to push it a little bit, 2 or 3 seconds, and then come back up. And as you warm up, as you get better at this movement, you try to bring your hips down further and further each time. So that's exercise number 2, the hero squat. The squat is another important movement to improve range of motion after a knee replacement surgery. We're going to start with the easiest variation. It's called a wall squat or a ball squat. We're just going to use our medicine ball, put it on the wall, put our back up against the ball, and then we're just going to bend our knees while sliding down the wall. So you can see as I sink down, I got more and more knee flexion, which is usually what we're working on. And what you want to do, same with the other exercises. Go as low as you can, bring your hips as low as you can. Again, really trying to push into this end range as low as you can. Hold for 2 or 3 seconds, come back up, and repeat. Next, we're going to move to squat hold. So to perform this exercise, I like using a TRX, but really you just need anything that you can hold on to. It can be a doorknob, it can be the side of a wall, a table, a chair, anything that you can just hold on to. But to perform, all we're going to do is sink down in that same squat and really try to bring your hips as low as you can. And again, what's nice about these TRX is I can use my hands to really hold me up. It's not necessarily a strength exercise like a traditional squat, because I'm holding myself up and slowly lowering myself down. Again, same thing, trying to get my hips as low as I can to increase this knee flexion. And we can hold it for 5 seconds. And really, again, we're trying to push that range of motion, even if there's a little discomfort. And then we stand back up, and then we sink lower. Again, each time trying to sink lower and lower to get more knee flexion. And now we're moving into the side lunge mobilization. So to perform this exercise, you're going to want a wide stance. You're going to want your toes out at about 45 degrees. And then what we're going to do, we're just going to bend the side that we're trying to improve while we straighten this leg. So this is what the movement looks like. Coming back up, and it's the same as all the previous exercises where we really want to focus on sinking our hips down towards the floor, working on this knee extension, pressing back up, and then each time you go down, trying to get a little bit further. And if it helps, you can go back the other way, stretch out the hamstring a little bit too. It just feels good. But for that knee flexion, knee range of motion, you're really just bending over this front knee. So there you have it, 5 exercises you can use to increase knee range of motion after a knee replacement surgery. I wanted to reiterate again that these more active exercises are meant to be done after the healing has taken place. So this is 6 to 12 months out of surgery. If you're still having problems with your knee range of motion, that's when to incorporate these more active range of motion exercises and really start to build strength without stressing or injuring that joint, which might be trying to heal right after surgery. So that's all I got for you today. My name again is Dr. Carl Baird. If you have any questions, leave them in the comments below. I'm happy to help in any way that I can. Thank you so much for watching. Hey, it's Dr. Baird here. Don't forget to subscribe to our YouTube page to catch all our videos designed to help you build the strength and confidence to live active, healthy, and happy lives. You won't find it anywhere else.